My name is Gideon Oyagi. I'm the Deputy County Commissioner, Nyandarua Central. I'm representing the County Commissioner. Last week we launched this committee, and since that day we have been putting in place all the measures necessary to ensure that we are adequately prepared to handle any case in case it unfortunately occurs. You have gotten it from the technical department, but there is an area I want to emphasize. All of you are aware that the CS suspended all gatherings, all meetings, all events, and even inter-school activities. We want to urge all the people of Nyandarua to take the announcement seriously, because it affects our individual lives and institutions. To that extent, I want to request that we take the caution seriously, and this is a time, as the doctor has indicated, that we need not ask many questions. Let us take the caution from experts seriously. Let us not misinform the public. Unless you have information clarified by the technical department, kindly let us not convey messages or information that we don't know. As we move forward as a committee, I want to say that on behalf of the county commissioner, who co-chairs together with the governor, we'll be giving you information as quickly as possible, immediately we get it. And in case you want any clarification, kindly get in touch with the secretariat that will be able to give you any information that you may require. For now, we want to ask you as members of this county to remain responsible in terms of how you report, in terms of how you conduct yourself, so that you follow what the doctor has told you, particularly the simple instructions that we have been given, not to greet each other. You have been told that you have to wash your hands with a soap. They are very simple instructions, but kindly let us follow those instructions. Kindly, on the other hand, be our ambassadors. The Wanchiku right in the village does not have the information we are giving you. Be our ambassadors and ensure Wanchiku gets the correct message. Otherwise, thank you.
Thank you. I'm Dr. Mungai John. I'm in charge of health. I'm the Minister in charge of Health, Nyandarua County. This is one of the isolation units in Nyandarua. We have 3. One at GM Kariku Memorial Hospital, which has 8 isolation beds. 7 are already ready. We have another unit at Engineer County Referral Hospital in Kinangop, which is ready, has 80 beds. And we have another unit at North Kinangop Catholic Mission Hospital with 6 beds. As we can see here, we have one of our staff dressed in personal protective clothing that are used for any highly infectious disease like coronavirus. Has a call center, and that call center has a dedicated line which I've already given to the public. And we're asking our partners, media partners, to disseminate that number and the health messages to the public, not to panic, but to be prepared. We're asking them that this is a time to obey healthy orders, to wash our hands with soap and water, to keep a distance about 1 meter, and when we are told not to gather, for example, the church may be told before people enter, they wash their hands with hand sanitizer. We're asking the opinion leaders, the church leaders, the school heads, and of course the politicians to all cooperate. Let's all keep safe for our people. We hope we don't get a case in Nyandarua, but we have to be prepared like everyone else. Thank you. I don't know. Thank you.
My name is Samuel Maura. I'm the team leader of the technical team at the emergency center. And as of now in the county, we don't have any case, and we have not had any contacts with for people who have any contact with the confirmed case. So we are keeping our eyes open so that in case we get a case, we can be able to handle at our level. That is why we are putting the team in place. And what I'm saying is that we are going to do screening for our patients who are coming in, because the coronavirus is has symptoms like any other respiratory disease. So we cannot be able to identify which is the symptoms for coronavirus and other respiratory disease unless we do the screening. So we are going to put our staff, our technical people on the gate so that they can take the temperatures of the people who are coming in, because anybody who has a symptom, first they will come to the hospital. So we are going to do enhance our screening so that we can be able to identify if we have any case. So as for now, we are just putting the team in place and getting ready. Thank you.
Schools, to churches, to all opinion leaders in the county, so that they can take preventative measures. We are all aware that.
My name is Rona. I'm the team leader of this emergency.
Right, good afternoon. For people, good afternoon. I'm Dicho Inina, Radio Africa Group. Any member of the public can call from anywhere from the world. So we are going to disperse this number or any other health emergency. There will be someone to pick this number and to direct them what to do.
Surveillance coordinator. For this case, I'll be doing the in terms of managing patients.
CEC in charge of education and the CEC in charge of transport. Call center at my boardroom there. The line and start the service. Workers whom we have forgotten, then make it. That's what Karen who is in charge of the infection prevention control. We have there's water. There's water there. There's soap and that's better. You can serve the public when they are responsible. In the hospital, these are almost that. So this is a mirror solution. The governor and chaired by the town commission. So we some secret team.
Wash hands, avoid crowded areas, and make sure that you do 3, 4, 5, then here, and then
Is there a jig there?
No, we have not. that we are going to spray the whole suit before she removes this bag. So the whole suit, after handling each patient, is going to be put in this bag. Okay, really would like to is going to shield the droplets from the patient to the health worker. And then you have a mask.
Our teams have been trained in Nairobi. With us is
The infection. Then after this health worker is through with hand